Hello, I'm Hyun Chang-Kim from South Korea. I'm very happy and honored that our team study was chosen as one of the research award by Oral Reconstruction Foundation. This study was teamed up with multiple universities, which are University of Zurich in Switzerland and Yonsei University and Gyeonggi University in South Korea. The title of the study is Tissue Integration of Zirconia and Titanium Implant with and without buccal dehiscence defect, a histologic and radiographical clinical study. Nowadays, an increasing number of dental implants are placed. This leads to an increasing number of tissue augmentation procedures simultaneously with implant surgeries. Majority of the situation requiring tissue augmentation may be the buccal bone dehiscence defect on the implant. In general, we do bone augmentation procedure to handle this situation. Interestingly, some studies reported outcomes regarding the absence of buccal bone plate on the implant retrospectively or prospectively. Let's take a look at two studies. In one study, it was found that no buccal bone plate was presented on the immediately placed titanium implant after 7 years, but these implants were clinically healthy except for roughly 1 millimeter of mucosal recession. In another study, for titanium implants with buccal dehiscence defect, the authors compared the outcomes between with guided bone regeneration and with spontaneous healing. They demonstrated clinically and radiographically healthy status on both groups after 18 months of follow-up. However, there is no study regarding the tissue response of zirconia implants with buccal bone dehiscence. Therefore, the aim of the present study was to histologically and radiographically evaluate hard and soft tissue integration of two-piece titanium and zirconia implant with and without buccal dehiscence defect. For this study, preclinical animal model using canine mandible was used. The study protocol was approved by local ethical committee. During the whole study period, ARRIVE guidelines were strictly followed. 5 groups were established. Group Z1 represents zirconia implant with modified surface, which was placed within bony housing. Group G2 represents zirconia implant with standard surface, which was placed within bony housing. Group T represents titanium implant placed within bony housing. Group Z1D is Z1 implant placed with 3 mm of buccal bone dehiscence. Group TD is titanium implant placed with 3 mm of buccal bone dehiscence. This is the schedule of the experiments. Firstly, mandibular second, third, and fourth premolars and the first molars were extracted, and at the same time, for the group Z1D and group TD, buccal bone plate was removed for creating chronic type of dehiscence defect. After 8 weeks of healing, 5 implants were placed in one side of mandible. Then, implant crowns were connected to the dose implant after 8 weeks post-implant placement. On the other side of mandible, 5 implants were placed at 38 weeks following tooth extraction. At 40 weeks, specimens containing the tissue and the implants were retrieved for histologic and histomorphometric analysis. So, one side of the mandible was served as loading condition for 6 months, and the other side of mandible was served as 2 weeks of early healing. This is the clinical photographs from the experiment. On uppermost area, you can identify each group. The height of the dehiscence was 3 mm as you can see. Clinical healing was uneventful for all groups. For loading on one side of mandible, prefabricated CAD-CAM crowns were connected. On the lowest area, you can see the final healing situation. We did histomorphometric measurement with the retrieved specimens. Firstly, 5 landmarks were identified, which are margo mucosa, implant shoulder, apical extension of the junctional epithelium, bone crest, and the first bone implant contact. You can see the abbreviation of those landmarks on the center of the screen. Using these landmarks, the distance between MM and IS, the distance between MM and AZE, the distance between MM and FBIC, the distance between IS and FBIC, and the distance between BC and FBIC were measured. Moreover, the percentage of bone-to-implant contact was assessed. During the animal experiment, periapical radiographs using a parallel technique were taken so we could compare the level of marginal bone over time. In order to determine statistically significant difference, mixed linear model was used. Here is the representative histologic views at 2 weeks of healing. In the group Z1D and group TD, lower level of the first bone-to-implant contact is noted. These are the representative histologic view at 6 months of loading. All implants were successfully integrated. No implant were failed. Some tissue remodeling were happened. Let's look at the histomorphometric measurement. Firstly, the level of margo mucosa. The median level of margo mucosa was located coronally relative to the implant shoulder in all the group. The range of this distance was between 1.6 mm and 2.6 mm at 2 weeks, and between 1.2 mm and 1.6 mm at 6 months. Over time, all groups demonstrated apical shift of the mucosal margin. This apical shift was 0.5 mm in the Z1 implant with buccal bony dehiscence and 1.3 mm in the titanium implant with dehiscence. Those values reached borderline statistical significance. When you look at the bone level with respect to implant shoulder, median value of the bone level in the groups with dehiscence defect changed to some extent, but there was no statistically significant difference. This slide shows the height of the periimplant mucosa, which is the distance between the margo mucosa and the first bone-to-implant contact. In titanium implant with dehiscence, there was approximately 1.5 mm of loss over time, which was statistically significantly different. However, interesting enough, there was no statistically significant difference in the Z1 implant with bone dehiscence. Moreover, the height of the peri-implant mucosa in the Z1 implant with dehiscence was significantly higher compared to the Z1 implant and the titanium implant after 6 months of loading. Previously, some studies demonstrated superior soft tissue response in zirconia implant compared to the titanium implant. In our study, this point was also proved in terms of less apical shift of the mucosal margin and maintenance of peri-implant mucosal height. Especially, even in the presence of buccal bone dehiscence, soft tissue seems to be stable compared to the titanium implant. The next is the bone-to-implant contact. These graphs clearly shows us zirconia implant had almost similar capacity in terms of osseointegration compared to titanium implant, especially Z1 implant with a modified surface exhibited greatest value at 6 months of loading. We measured radiographic bone level using a periapical radiographs. As you can see, there was a minimal difference between groups over time. There was no statistically significant group effect indicating marginal bone stability in all implant groups. Let's summarize the finding. First, Titanium implant demonstrated significant loss of peri-implant mucosal height when it had buccal bone descent compared to zirconia implant with buccal bone descent. This loss was mainly due to greater apical shift of mucosal margin in the titanium implant. Second, Z1 implant with a modified surface enhanced osseointegration. Third, all implant without buccal bone descent demonstrate stable marginal bone levels at 6 months loading. Judging from these findings, we can understand high potential of zirconia implant even in the presence of buccal bone descent. But you have to have in mind that these results were derived from preclinical study, so our next step should be clinical trial. Thank you for watching my presentation. I hope everyone stays safe from coronavirus. And I appreciate the great mentoring by Professor Christophe Hammerle, Professor Danny Thoma, Professor Ronnie Young, and Professor Uiwon Jung, and huge devotion of Dr. Kyungwon Peng. Thank you very much.